This is Health Yeah, your weekly update on what's going on in the health, wellness, and medical world with Monica Robbins.
Hey everyone, welcome to Health Yeah, your prescription for clear, concise medical health and wellness information. I'm Monica Robbins. Today's episode is about an issue that is affecting more than 6 million Americans and will likely affect millions more in the next decades to come. And due to COVID, even more may be suffering from this debilitating disease. We're talking about Alzheimer's disease, and joining me is Rebecca Hall, Program Director for the Alzheimers Association Cleveland chapter. Rebecca, thank you so much for being here.
Thanks for having me on.
All right, so one question I get a lot is there is a lot of confusion about what is Alzheimer's disease and dementia. Can you explain, is there a difference?
Yeah, that's a great question, and it's one that we get often as well. I'm sure you can imagine, because a lot of times people use those words interchangeably, Alzheimer's disease and dementia. And a great way to think about it is, as we always explain, dementia is an umbrella term. So dementia is a set of symptoms. It's memory loss, changes in thinking, confusion. It's all those symptoms, and that can be caused by various conditions, diseases, and issues that are going on. For example, the most common disease that causes dementia is Alzheimer's disease, but there are other types of dementia. So people can get dementia with Parkinson's disease, and we call that Parkinson's related dementia. Or people can get what's called vascular dementia, which is related to stroke. So there are various issues and diseases that can cause dementia. So dementia is really that umbrella term that refers to the symptoms that are related to memory loss, confusion, and problems in thinking.
And there are, what, dozens, if not hundreds of different types of dementia people can get?
Yeah, there are many kinds of illnesses, conditions, diseases that could cause the symptoms of dementia, like Alzheimer's disease, like I mentioned, Parkinson's disease. There's frontotemporal dementia. There's vascular dementia, there's mixed dementia where you can have more than one type of dementia going on. But there's also other conditions and other issues that can look like dementia, but actually aren't. So there are things like depression, vitamin deficiencies, and other issues that could be going on that could cause those same kind of symptoms and look like dementia, but really isn't. So that's why it's so important for people to get a diagnosis and to really talk to their doctor when they see those kind of symptoms.
So I mentioned the 6 million Americans off the top, but there's a big concern. Let's talk about the statistics now and what's projected for Ohio.
Yeah, so the statistics right now, as you mentioned, 6 million Americans are living with Alzheimer's disease. And in Ohio, there's about 220,000 people 65 and older that are living with Alzheimer's disease. And there are like 440 or 450,000 caregivers. So it's such a huge issue because not only are we talking about people that are living with the disease, but also those who are providing care for them. And there's usually more than one person involved in that care. And that number, as you mentioned, the number of people living with dementia is projected to continue to increase over the coming decades because of the aging population and because of better diagnosis. And so we're going to see more and more people being diagnosed with Alzheimer's and dementia. And then, of course, because of that, more and more people who are caregivers of those living with dementia. So those numbers are going to even continue to increase as we move on.
And that brings a whole host of other issues, places for care, not enough caregivers. I can't imagine how is the Alzheimer's Association involved in planning for this literal onslaught?
Yeah, so in so many ways, the Alzheimer's Association is on the front lines of battling Alzheimer's and dementia. Of course, I'm sure we'll talk more as we go through our conversation about the support that we provide to people living with the disease, but also a couple of other things. The Alzheimer's Association is really involved in advocacy efforts. So how can we change what's happening at the state and national and even local level around legislation that can provide additional support to caregivers, budget funding for programs that can provide additional support to caregivers and people living with dementia. How can we invest in that? Because we know that it's coming, as we talked about. And so the Alzheimer's Association is involved in talking with local, state, and national legislators and lawmakers every day, trying to figure out some solutions to how we're going to deal with this growing disease.
Is there any legislation pending or on the books right now that people should be watching for, and maybe even if they're impacted by this, contacting their local lawmakers?
Yeah, I think that there's always, it kind of depends on where the person lives. So I would suggest that, checking out the Alzheimer's Association website at alz.org, and you can really look into what's happening in your local area. And then we're always involved in advocacy efforts at the state level with respect to funding for the Department of Aging and other resources. There's an Alzheimer's Association task force, or an Alzheimer's disease task force at the state level, working to address creating a state plan for Alzheimer's. So there's just a lot going on. And it kind of depends on where you live, also what might be happening. So I really suggest, people getting connected with us and finding out how they can get involved in our advocacy efforts.
Let's talk about demographics. Who is most impacted by Alzheimer's disease?
So Alzheimer's disease, as far as the biggest risk factor, is age. So people over 65, and especially people over 85 are more likely in general to get Alzheimer's or dementia. Age is the biggest risk factor. But there are some other demographic risk factors as well. More people who are diagnosed with Alzheimer's and dementia are women. So women are more likely to have Alzheimer's or dementia. Some of that's because women live longer than men, but that doesn't explain all of that. So it is something. And then women are more often caregivers. So Alzheimer's and dementia does impact women a lot in the area of caregiving and in the area of being diagnosed with dementia. And then the other thing to know is that African Americans and Hispanics are more likely to be diagnosed with Alzheimer's or dementia. So it is very important to take a look at why that's the case, why that's happening. And so there's a lot of research going into that, and we'll talk more about research, but there's a lot of research going into, kind of what these risk factors are and how we might mitigate them. But yeah, it's important to know that more women, more African Americans, more Hispanics are diagnosed with Alzheimer's disease. So it is something that we need to think about.
So we're still in the midst of this pandemic, and we're learning new things every day. And one of the things that is a very concerning issue is how this virus is affecting the brain. And there are some that are predicting that we're going to see more and more early onset dementia from people who've had COVID. Can you talk about what you're hearing, what you're seeing, and what do people need to be aware of?
Yeah, I think it's something that we are going to continue to learn more about as we move forward and work through this pandemic. I think we're going to continue to learn more. We've heard about some of the impacts on the brain with long COVID. We've heard about the impact of COVID on cognitive decline. and dementia and contributing to cognitive decline. And I think that there is probably going to be even more that comes out as we learn more. And I know there's research going on right now into COVID and its effect on cognitive decline and dementia. So I think that we'll continue to learn more. And COVID has just had a huge impact on people living with the disease already. I think it's interesting to see where what the research shows about how COVID may lead to additional cognitive decline. And then I think, it's had a huge impact on people caregiving. So it's just been, devastating for everyone, but for people impacted by Alzheimer's and dementia especially.
We touched on research, and fortunately for us, there's a lot of research happening right here locally. Can you kind of highlight some of the things that we need to be watching for?
Yeah, well, we've talked a lot about, risk factors. And so I think that there's a lot of exciting research going into how do we reduce the risk of someone developing Alzheimer's or dementia in the first place. And I think a lot of the exciting research, locally, I just read about something out of looking into better diagnosis for Lewy body dementia, which I think is exciting. And then, there's a lot of research around, of course, medication for treatment. And I think one of the most exciting things, though, happening is in a couple of areas. There's research happening and all over the country, all over the world into Alzheimer's and dementia, and the Alzheimer's Association recently just convened our Alzheimer's Association International Conference on research. And some of the most exciting things that I think are happening, similar to the study I mentioned with the Lewy body dementia, is those studies that are looking into what we can do to recognize and diagnose dementia earlier on, and how we can use that information to develop better treatments and interventions. So I think early diagnosis and early intervention and those kinds of study are really exciting because the earlier we can get people, the better outcomes they're going to have. And then I think the other exciting research that's happening and that I get the most excited about is the research into risk reduction and prevention. So what are those lifestyle factors? What are those things that we can put in place with our behaviors and with our health conditions that we might be experiencing and the treatment of those that are going to help reduce our risk or even potentially prevent us from developing dementia in the first place? Because if we can do that, then we don't have to talk about, the cure and the treatment if someday we can find the prevention. So, and I'm not saying that's going to happen tomorrow, right? All of this research takes time. And, we learn so much along the way, but I think those are some of the exciting things that are happening right now.
I know one of the things I've done stories on in the past relating to the metabolic syndrome, where I'm gonna forget some of these, so help me out. I know it's obesity, high blood pressure, oh my goodness, diabetes,
Yeah.
and there's a couple other things that people need to be concerned about. If they have that, they are more likely to develop Alzheimer's disease. So there's some lifestyle factors. Again, the bottom line, it comes back to, better diet, losing weight, being more active, could make a big difference. There was a lot of controversy recently because as we're talking about research, there was a medication that was just recently approved. It was the first one in 20 years. And if I'm not mistaken, there's probably maybe less than half a dozen medications on the market right now. And this was a medication that everybody was so excited about, except the advisory board at the FDA. And the FDA, I know the Alzheimer's Association was a proponent of this medication, it got approved, but now there's a fight trying to, I don't know, is it getting unapproved or what's going on with this? Because I know you guys are on the front lines.
Yeah, I do think there's a lot of excitement around this initially when it came out, and rightfully so, because this is the first treatment approved for Alzheimer's disease since the early 2000s, and the first treatment to address the underlying disease. So to actually make a difference on the progression of the disease in the brain. So that's why it's so exciting, because the other medications, that we've had that have come out are really treating the symptoms. So which is also so important, but not changing the underlying progression of the disease. So the disease is still getting worse. And this is the first treatment approved to treat the underlying biology of Alzheimer's disease. And that is exciting. So there is so much excitement around it. A couple things that, I think, the Alzheimer's Association, we, as you said, supported the FDA's accelerated approval of, it's called Aduhelm or aducanumab. And, we were proponents of that, as you said, and welcomed that. But we also do encourage more research into it, and encourage people who are interested in learning more about the treatment for themselves to really talk to their doctors about it. I mean, there has been a lot of information recently in the news about, who this drug is that will best work for. And that's why, because there's a lot that came out initially. And then, there was kind of some information saying that, really is best for people with mild cognitive decline and early dementia, and that's who it should be prescribed for. And that's who the clinical trials were with. And that we agree that is, who this drug is especially going to benefit. But, having people talk to their doctors about whether this is something that would work for them is definitely a good thing. And there's also been, some controversy surrounding the cost of the drug. We've seen that following the approval, the manufacturer of the drug, Biogen, announced their intention to price the drug at over $50,000 a year, and that's that's a barrier to access for this drug. And so the Alzheimer's Association does believe that pricing is unacceptable, and that it will, as mentioned, create a barrier to some people having access to the disease. So the Alzheimer's Association, even though we fully support that decision that the FDA made to accelerate approval of the drug, there are some additional issues that need to be worked out with respect to the price. And we're going to continue to advocate for the best path to accessing this drug for all who are likely to benefit. And we believe that, that, as the research is showing, people in that mild cognitive impairment or that early stage of the disease. But
So,
this, it's just exciting because this is the first drug in a long time, and it does give hope to people where there really isn't a lot of option or hope right now, and this does provide that.
yeah, there was one silver lining I found over this controversy is regardless, this opened the door for research, and there's probably half a dozen other drugs in the
Yeah.
pipeline right now
Yeah.
that are going to be focusing on, like you said, the biology of the disease and going after it. So we may be entering, my hope is a whole
Yeah.
new era of medication to treat, what causes
Yeah.
this disease and hopefully, maybe someday reverse it.
Yeah,
But
I think that's a really good point, is that it will encourage other investments in research. And there are other drugs already, coming through the pipeline, as we speak. So I do think it will spur additional research, which is so important and exciting.
You mentioned caregivers a number of times, and we know Alzheimer's alone is devastating to the patient, but for the caregivers, and I have personal experience with this, that it is utterly devastating. It is so confusing, so emotionally draining. Um, so, but during a pandemic, I can't even begin to fathom how people who had loved ones in nursing homes or, taking care of them at home were dealing. Can you talk about how the pandemic impacted caregivers?
Yeah. Um, yeah, in the early days of the pandemic, we heard from so many caregivers who were struggling because they couldn't get into the nursing homes or assisted living facilities or whatever it might have been, in order to see their loved one living with dementia because it was just too dangerous. I mean, um, people in nursing homes were at such a high risk of contracting COVID-19. And so it was very difficult, to not be able to see their loved ones and not be able to make sure that they were getting their needs met and make sure they were safe. And of course, it was also very difficult for the people with dementia because they didn't understand what was going on or remember from day to day what was happening. And one of the most difficult things, I think, I talked to, several caregivers, during the course of the pandemic, especially before we had the vaccine and things began to open up a little bit. But I think one of the hardest things was that many caregivers saw their loved ones decline, while they were in, the nursing homes and not being able to see loved ones and not really being able to engage fully in activities or eat meals with other residents. And that kind of isolation and, lack of social and mental stimulation, um, and that's depression, not seeing family members and feeling alone and not understanding can really actually lead to, um, additional cognitive decline. We see that when a person with dementia's environment or circumstances change, they often do have that cognitive decline, that you'll see. And that was really hard for a lot of caregivers and not feeling like they could be there. So there was just so much impact on loved ones. And, even for some people, unfortunately, whose loved ones passed away and not being able to really be there through that process, in the early days of the pandemic was really difficult. So I think it just made such a huge impact on the grief process for caregivers, and on being able to really still feel connected with their loved one. I mean, seeing people through windows and over FaceTime, or is that what it's called? FaceTime, Zoom, or whatever it might be. Was difficult for a lot of people. For a lot of people with dementia, that technology, might not work as well for connection.
Yeah, that was my question. Did we learn anything? Because that was the one thing everybody was, Zoom and Skype and everything else
Yeah.
became so popular. Did we learn anything, or is it still too soon after, what we went through?
I'm sure that we've learned and that there will be things that come out of this that will make us think about the way that we do things. But I think that the resiliency of people is what I've really learned, because one of the things that I heard were all of the creative ways that people would still try to connect with their loved ones, like, sitting outside the window, of their room and bringing like a picnic and, eating at the same time with that loved one, or bringing the grandchild to the window to wave, and just so many different ways, doing things outside when possible, of still connecting. It just shows you how resilient people are, and, how hard people work, even the staff at the nursing homes, just how hard people work to try to make things happen in the worst of situations. So I think we'll learn more as we go through.
Well, as we know that these numbers are going to increase, can you give us, for potential future caregivers, signs and symptoms that they should be watching for? When do they take the loved one to the doctor to get evaluated? How does that work? Where do they find the information to even start?
Yeah. it can be so overwhelming. And so I think one of the biggest things that we tell people, and not just people with, loved ones who they're worried about, but everybody, to know the warning signs of dementia. It's not just memory loss, although that's a huge part of it, but it's also confusion. It's also not being able to do things that were familiar to them. It's slower reaction times, having harder time focusing and keeping up with conversations with their loved ones. um, it's losing things and not being able to find them. It's those types of symptoms we have on our website. If you go to alz.org, you can click on the Alzheimer's and dementia and find 10 warning signs. And I encourage everyone, whatever your age, whatever your situation, to go on and learn what are those 10 signs and be able to recognize those. And then when you see those symptoms in a loved one, talk to the doctor about those. Talk to your loved one, talk to the doctor. Like I said in the beginning, you might see those symptoms with other types of illnesses or diseases that aren't dementia, that are treatable and that you want to deal with. And then, of course, if it is dementia, you're going to want to begin that process of talking with the doctor and trying to do a process of elimination. What else might it be? And then moving forward, if it looks like dementia might be an issue, moving forward through that process of a diagnosis. So a mental status exam, and some other types of testing that they're probably going to do to rule things out. So it is something where everyone needs to be aware of the 10 signs and really take action on those early, remembering that it's not normal aging to experience these symptoms. Because sometimes we want to say, well, that's just kind of what happens to people when they get older. And then we wait for a crisis, like the person has a car accident, a little fender bender, or gets lost somewhere and doesn't remember. We wait for a crisis and then we say, oh, we need to do something about this. But all the treatments that we have, all of the interventions that we can do are better and more effective earlier on in the disease. So we really encourage that. And I think the Alzheimer's Association is a great place to start for learning that information and for getting caregiver resources.
So there is now another resource through the Alzheimer's Association that's brand new, targeted to caregivers. Can you tell me about that?
Yeah, so the Alzheimer's Association, Cleveland area and Greater East Ohio area chapters are fortunate enough to receive a generous gift from Jan Castora, who was a former dementia caregiver himself. His wife passed away a couple of years ago with dementia, and he felt so strongly that caregivers need a break. They need relief. And from that day-to-day caregiving, that he donated $1 million to the Alzheimer's Association Cleveland area chapter to create a program called the Jan and Josephine Castora Family Caregiver Relief Fund that provides grants to caregivers of people living with Alzheimer's and dementia to allow them to get a break, to take some time for themselves, to take care of themselves, and during that time get in-home care paid for. So, the Alzheimer's Association is contracting with different agencies that can provide companion care, personal care services like bathing, dressing, grooming, all those things that are so challenging for caregivers. So it's just a wonderful opportunity for us to be able to provide this service. And there are some, eligibility requirements that, we can probably put the link or more information that people can get the specifics of the program. But it's just such a wonderful opportunity for caregivers because, as it is such a huge need for caregivers to be able to take some time for themselves to take care of themselves.
Well, the other thing too is it's devastatingly expensive
Yeah.
to take care of someone, because you never know how long this is going to last. I mean, you can go
Yes.
10 years or more
Yes.
um, as a caregiver. That's great. And I will put the link to this in the explainer of this podcast so people can find
Wonderful.
it easier. So there is another event coming up on August 12th. And full disclosure, my band is playing the Ninja Cowboys. This is an event that's happening in Lorain again on August 12th, 2021, when you're listening to this podcast. Can you fill us in? Give us the details. What is the event for? What's the money going to? All the details.
Wonderful. Yeah, thanks for giving us the opportunity to talk about this. So we're doing this in partnership with Springer Healthcare. It's called Light It Up Purple, and it's an event for the Lorain County Walk to End Alzheimer's. So this charity event is gonna gonna benefit the Cleveland area Alzheimer's Association. And as you mentioned, it's taking place Thursday, August 12th, 5:30 to 9 at the Lorain Palace Theater. And tickets are going to be available ahead of time and at the door as well. So I think it'll just be a fun, exciting event. There's going to be a signature cocktail. There's going to be, as you mentioned, event entertainment. So I think it's just going to be an exciting event. And it's so important because it's so great to be able to come together for something like this, fun event. But that's so important in helping us raise money for funds for all of the things that we talked about, providing support and care to people living with the disease, but also the Walk to End Alzheimer's, which this event supports, is our biggest fundraiser. And so much of those funds go to supporting people locally who are living with the disease, but also to funding research for the treatment and the cure, hopefully, eventually, that we've been talking about through this conversation. So we're so excited to be able to partner to provide this event.
So how much are tickets and where is it taking place?
So Lorain Palace Theater in downtown Lorain, and tickets are $25. So you can purchase those ahead of time and at the door, and we could probably also put more information in the details of this conversation as well.
Absolutely. Absolutely. All right. Is there anything else you would like to leave people with? Take home information. I know when somebody's dealing with this, they tend to Google just about anything, and there's no way in health we want them to do that. You already gave alz.org, and we will, of course, include the links to the Caregiver Fund and the event for next Thursday. But also talk about any other resources people should, make their first stop when they are just starting on this journey.
Great question. And thanks for saying that, because I do think, whenever we're facing something like this, of course we're overwhelmed. Of course we want more information, and Dr. Google is there, right? So we kind of want to go there and find out everything that we can. And it can be so overwhelming. So I think the best place to start is with trusted resources in the community. And of course, we've been talking about the Alzheimer's Association, but I also want to say, to contact your local area agency on aging. So that's another, that is something that you can Google, because, it's going to be different depending on where you live. But look for your local area agency on aging, because they can connect you also with different programs and resources in the community. And they're going to be able to give you, just like the Alzheimer's Association, information that is from a good source and reliable. And if people are looking for just information, I always recommend alz.org, our website, or NIH, the National Institute of Health, has a lot of great information about Alzheimer's and dementia, and that it's research-based and it's coming from reputable sources, because you're going to Google and you're going to see all kinds of things out there, and it's going to be overwhelming. And the best advice I can give is, if you are dealing with this disease and you just had a loved one diagnosed, is to start small. Start with the first step. What's the first step? Do you need support? Do you need more information? And just start there. Don't get so overwhelmed, because there's enough to be overwhelmed about, but you don't want to get overwhelmed with all this information that could be out there that sounds scary, sounds intimidating, may or may not be true. So I would just suggest starting with the Alzheimer's Association as well as your local area agency on aging.
Great advice. Rebecca Hall, thank you so much for your insight. I know this is going to be a lot of valuable information for a lot of people. Thank you.
Thanks so much for having me on.
Please find me on Twitter and Instagram at Monica Robbins. Like and follow my Facebook page, Monica Robbins WKYC. Subscribe and find video podcasts on my YouTube channel, Monica Robbins. Until next time, have a healthy week.
Thanks for listening to Health Yeah with Monica Robbins from WKYC Studios. Subscribe now so you never miss an update. And find more on everything you heard here on WKYC.com and on the WKYC app.